Outside, I'd like to thank AIOS for giving me this opportunity. Uh, can we have the slide, please? Yeah. So I'll be speaking on next generation mapping of 3D epithelium thickness, a novel tool to assess wound healing post-refractive surgery. Now, why is it important? Epithelium can in fact throw light to multiple things which we sometimes miss post-epithelial, post any refractive surgery. So thereby, what is the need? Why do we actually need to study healing patterns post any refractive surgery? Now, I know I'm not in an orthopedics lecture, but post any person injuring himself, having a fracture, there are various ways the bone actually heals. Some normal, some abnormal, some aberrant. Likewise, the similar ways post epithelial, post any refractive surgery, there are multiple ways in which an epithelium can actually heal, and this in fact can help us in prognosticating and defining outcomes post any refractive surgery. So what we did is we wanted to integrate and use our knowledge on artificial intelligence, our existing knowledge on algorithms, and whether linking artificial intelligence to refractive surgeries help us in improving outcomes. Now, we did a retrospective analysis at our center where we looked at 200 eyes, 50 of them undergoing PRK, 50 undergoing a transepithelial PRK, 50 undergoing LASIK, and 50 undergoing SMILE. So we used the standard anterior segment OCT OptoView, which looked at the air epithelium and the epithelium Bowman's interface. We then ran a Zernike's analysis on these on the epithelium thickness distribution and arrived at a novel index. The novel index was basically the epithelium Zernike's index. What we derived was that the ratio of the constant to the sum of the lower order and the higher order aberrations in fact is statistically significantly different from each one of these groups, and assessing these aberrometric indices post epithelial, post refractive surgery can in fact give us an idea as to what refractive surgery the patient has undergone. So we basically classified these indices as to whether they had local changes or whether they had global changes in the thickness of the distribution. So what we found was that if you look at the increase in the central epithelium thickness post-operatively, it was similar between the surgeries. And when we looked at the aberrometric indices, like I said, the epithelium Zernike's indices is what we have coined. We looked at the higher order and lower order aberrations. It was increased in cases of SMILE LASIK as well as in the trans PRKs. But when we looked at the manual PRKs, the lower order aberrations increased. So how did we actually build this? So we used our these epithelial indices and integrated that into something known as a decision tree classifier. Now, a decision tree classifier, in fact, one of them is a random forest classifier. It's an existing AI algorithm where there are discriminant nodes. Now, each one of these nodes, we give a cutoff value for a variable. Now, in this case, we're looking at epithelial healing patterns post refractive surgery. Now, if a value is greater than that of what is set in the AI algorithm, it then goes into the next node. So random forest in fact picks up random variables and helps in classifying. So in this case, it was this epithelial indices was helping us in classifying the type of refractive surgeries the patient was undergoing. And using this, we were actually able to arrive at a post-operative probable healing pattern of epithelium, which could in fact help us in figuring out outcomes post-refractive surgery. So we used something known as a confusion matrix, which was a part of the AI algorithm which we used. And what we found out was that to almost 90% of the times, it was actually correctly able to pick up what type of surgery just by analyzing the aberration profile of these aberration indices. What we call the epithelial Zernike's indices is what we have hypothesized. So like I said, this concept of machine learning, many of the today's era, artificial intelligence has taken over. So utilizing our retrospective analysis of epithelium indices, we were in fact successfully able to predict outcomes in terms of epithelial healing post-refractive surgery. So what exactly can it help us in? It can actually help us in creating algorithms to predict post-operative healing patterns and to choose the most appropriate refractive surgery based on the patient's existing epithelial indices which exist. Where are the clinical applications? This is in fact early work. We still have to validate this in terms of a larger amount of patients. But we've looked at patients with unusual keratometries and tried our AI algorithm, and it was able to predict what type of surgery would be most suitable in terms of visual outcomes. We also looked at patients with suspicious topographies and whether integrating this and integrating the epithelial healing patterns, whether it was able to pick up whether it was ectatic or not, and it did to some extent help us in predict that as well. Another indication was especially epithelial regression. In these patients do come back post-operative or post-refractive surgery. Epithelial healing and epithelial hypertrophy could be an indication as to the cause of regression. And using AI algorithms, we were able to predict whether there was a regression or not. So this is in fact early work. We have extrapolated this index into as well as epithelium healing post in keratoconic patients. We have started looking at the epithelium post cross-linking as well. We looked at 350 patients, and we have also looked at topographic parameters. This is our next field of work, and integrating this into our existing knowledge on the epithelial Zernicke's indices, whether we are actually able to differentiate normals from a form frustrate keratoconus. That's our next field of work. Now, this was early results. What is important is that our next step is to actually integrate our existing knowledge on artificial intelligence, integrate that with demographics and biomechanics as well as topography, and thereby helping in improving outcomes. So what we actually know is that AIOCT does help us in dissociate epithelium from topography, but this was a more precise way of mapping the epithelium, and AI in fact could be an additive tool in increasing accuracy of post-operative outcomes. Thank you.
Thank you. Thank you, Doctor.